Hi, everybody. My name is Ron Lake, Climate Coordinator for Duluth Public Schools, and with us today is Allie Randall. She is a specialist in prevention and suicide. She works for Carleton County Public Health and as the regional coordinator of suicide prevention. So thank you so much for being here today.
Yeah, thanks for having me.
Yeah, would you take a moment to introduce yourself and maybe talk for just a second about what we're going to do? And while you're doing that, I'm going to share my screen with everybody too.
Yeah, so like I was introduced, my name is Allie Randall and I work with Carleton County Public Health and Human Services. I'm a public health educator that works specifically on suicide prevention in the Northeast 7 counties. More specifically, I do crisis text line presentations to students all over the Northeast 7 counties. And with this new distant learning that we're all navigating together, we obviously need to find new ways to educate staff and students on suicide prevention and just emergency services when they do arise for mental health. So thanks again for having me.
Yeah, well, I feel real fortunate that we can partner on this together.
Yeah.
So what we have today to share with you is a quick slideshow and some comments from Allie on emergency distance learning and crisis support for students with mental health needs. As far as an agenda, we'll talk a little bit about prevention and responses, typical or common responses to crisis. We're going to be using our current mental health flow chart, and we're going to adjust that for distance learning. We have some risk of suicide information we're going to try and adjust for distance learning. We're going to talk a little bit about what happens when we do make that warm handoff from noticing somebody needs help to engaging them and trying to help them agree to get some help and then connecting into help. And then we got to take care of ourselves too. So we're going to spend a moment on that at the end too. First thing I want to share with folks is regarding prevention for mental health needs. Every positive interaction you have is prevention. Every attempt you make to contact or engage or teach kids, academics or social emotional learning is prevention. It's good mental health. Every good academic lesson you create or activity, every time you listen to understand somebody, every time you share a little bit about yourself, and balance, compassion, and accountability are all good mental health prevention strategies. And I appreciate your work that you're doing day in and day out to do all of these things. Then at the very bottom here, we're going to share this presentation with you. There'll be a link to this as well with the video. But know that there's a parent information to our Duluth Public Schools website that specifically has some information for them regarding mental health services, routines and schedules, and managing stress and anxiety that we're sharing out with all families. And we just wanted you to have a link to that information as well. The other thing I want to talk with you a moment about is resiliency. Ann Masson wrote a book, Ordinary Magic, and she identified a number of things that kids have going on in their life that create resiliency. And every one of these bolded and starred items are specifically things that as educators, we have a chance to create and directly impact. The connection to other competent and caring adults, that's you. You get to do that every day. Teaching kids problem-solving skills, self-regulation, positive beliefs about themselves and that life has meaning are all resiliency factors that we have a direct impact on. And of course, being connected to effective teachers in schools is something that we can have a direct impact on too. Allie, is there anything that you'd want to add about resilience or protective factors while we're on this slide?
Not necessarily to add, but just to comment on, I think it's really important that you guys do understand the importance of just your role of being there and how students and even just professionals in the field like me who don't necessarily interact with you on a daily basis can really feel your sense of dedication at this time and willingness to be flexible and willingness to adapt to the new terrain, and students can feed off of that. So all of these things that you said, Ron, with the resiliency do feed from what you're doing currently right now, which I think is just something to note.
Right. Yeah. Thanks for sharing that. There are some common responses from kids and adolescents during crisis. We aren't going to read through all of these, but they're grouped here, and you can come back to them, on your own time. But there are some things that are typical or common for kids. And I guess at the very end, I want to note there's some ideas about what's normal. So we want to be looking at or thinking about what's normal for the individual kid and what we know about them. And then when there's changes to what's normal, then that's an indicator. Allie, what else would you want to share about kids and teens' responses to crisis?
Yeah, oftentimes when I do student presentations, we break it down by two simple questions. We ask, is this normal for the student or your friend? And is it healthy? And those are two questions you can ask yourself even from a distance.
Yeah, those are two great questions that cover a lot of ground. It's a simple and meaningful screening. Thanks. So, Allie, in Duluth Public Schools, we use a mental health flowchart we created with actually through a partnership with Public Health. It's school specific. There's a template available at the bottom for schools to click on and link and then adjust. And we're going to try and work our way through this flowchart and make some connections or adjustments to using it during distance learning. First thing we want you to know or notice is that there's 3 levels of intervention. Going down the left column, it's I got it. You know what you're doing, you know the student, and you feel confident about your ability to provide some help or support. And maybe the level of need or risk is fairly low. And we just feel like we've got that. Down the middle is the column where we need help, but it's not an emergency. And then over on the right, it is an emergency and we need some help. And we're going to go through each of these. And then there's a bit of information on just providing support as well. So starting at the top, we want to recognize warning signs and then sort through the level of risk and how much, is this an emergency or not? Allie, what would you want to share regarding just getting started with kids when we notice some signs that we're concerned about?
Yeah, so obviously the first rule of thumb is that in order to see the sign or maybe get the sign or something from the student, we do need to initiate that brief contact in some way. And most of you guys do have contacts with your students regularly. So just making that a point. With watching these warning signs is things could look a lot different. They could say maybe something differently due to the distance between you. So you can't really read body language necessarily right now. So it's important that you take any warning signs seriously or any type of that gut reaction or any other student that shares a possible concern about a friend. We're going to take all of those seriously because we are at a distance.
Sure, that makes a ton of sense. And up in the upper right corner of our flowchart, we have an area to help us think about assessing that risk of harm. So we're going to go here next. Allie, what would you want to share about assessing the risk of harm as staff are kind of reading through these items on the left side of the screen?
Yeah, so assessing the risk of harm. The reason why you might see some headlines like increase in suicide during the pandemic or things like that nature is because our access risk of harm could be potentially a lot higher for our students and community members. So for example, seeking means, so maybe there is access to means or a firearm in the house they're in, at-home substance use, there might be an increase in financial stressors, loss of a parent's employment, obviously the self-isolation, and things like that. So our assess risk of harm needs to be a little bit more thorough now. Not to jump back to the last slide, but making sure that we are questioning anything we do feel like we need to know the answer to, right? So if we feel like we need to ask, then move forward with that. But we'll get to that later in the presentation. But I just wanted to add that there is a long list of the assessing the risk of harm, but that shouldn't deter you from helping the student by any means. It's not too big of a mountain. Sure.
And I guess in distance learning, or even in regular day-to-day education, the greater the risk, the more immediate the need to intervene or establish contact, and then the more interpersonal we might want the contact. So we might initially see the concern in something that a student wrote in an assignment. We notice that concern, we follow up and say, hey, we want to talk with you, tell us some more about this. And during that conversation or that interaction, we hear something that's really pretty concerning. Then we say, hey, are you willing to meet via Google Meet or a phone call so we can establish a more interpersonal contact. So then we do have a chance to hear the tone of voice and maybe even see some of the nonverbal communication. And like you said, Allie, if we are concerned about suicide, then we got to ask about it and probably ask directly about it. The greater the specificity of the plan or the actions, then the greater the risk and the more we need to take action. All right, over on the left side of our flow chart is the column for I've got this. And I guess, Allie, I'm wondering what you might want to add for staff that are going to enter in and support some kids with some either some low-level mental health needs or that are already in a relationship where they feel like they're providing the support.
Yeah. So first off, like we said on the last slide, making sure you have a good channel of communication. So whatever the student is comfortable with talking to you. So on there, it talks about phone, email, and things like that. And what I want to just highlight a few things that I saw just through a recent training I went to is that they talked a lot about school staff, making sure you're humanizing yourself. And so within talking and listening, sometimes just listening is enough, right? But making sure that you're really there to make them feel safe and supported at this time. One big key takeaway from my training was they said this is physical distance, not social distancing. So just because we're physically separated does not mean that this support and assistance and information like that can't be just as meaningful if it were to be in person.
That's a cool reframe, a new way to think about the distance piece. Yeah, thanks for sharing that. Down the middle, if it's not an emergency, but we feel like we need some help, some of the statements of empathy and the connecting with the student, the asking them who they work with and what do they need, sharing that we're going to figure this out together. Some of that is all remains the same, but the way we communicate, of course, is going to be different in this distance mode. What other factors kind of come to mind for you, Allie, when you start thinking about staff needing help in supporting a kid?
Yeah, so if you're moving forward now to give some of those statements, like you said, to assist a student, just some things I have down is to make sure you're hopeful and optimistic. Obviously, like we have written statements of empathy, things of that nature. One thing, key takeaway again from the training I recently went to, which I loved, by the way, obviously, because I keep talking about it, but they did say that students can read that you're not identifying the elephant in the room, which would be about the coronavirus. And you don't have to say anything you don't know, but it's important to identify that if you're feeling like that's what maybe the issue could be. And then with that, figuring out how to get them help together. Some few takeaways that I want you guys to understand is that some of them may fear that they're overwhelming you or overwhelming the system, or they don't need it as much as other people. That's just our own empathy, ticking. Making sure that you're setting up clear pathways for their help, and I'll kind of discuss that a little bit later. And then making sure you're flexible in this, so they might not get back to you until after your working hours and things like that.
Awesome. So yeah, the next section in our, kind of continuing down that middle column is trying to share some available options with students. And here I think it's important for staff and schools to be working at some point today, Monday, after this training, or having some conversation about what are the available options and how are kids going to access those, or how are staff going to make that warm handoff or connection to the available services, either through the school or the community. What do you want to add about this, Allie?
Yeah, I think sometimes this slide is similar to when I do a QPR training. If you've ever been at a store and you're looking for an item that you need, and you finally gain the courage to go ask staff at the store, okay, do you know if you guys have this available in stock? And then they go rope in a bunch of people and they kind of make a bigger deal. And your only question was, do you have this in stock, right? So think about that from a student's point of view. They finally ask you a question, and maybe you don't know the resource. It's okay to say, I don't know right now, but I'm going to find it quick and I'll get right back to you. And so the better answer to all this would be to know exactly where you're going to go next. So as we're walking through this training, we'll go over some resources. And so on there, it says, because there's many services still in place, we want you guys to familiarize yourself with services and how to access them with that warm handoff. It's going to look a lot different than walking a student down to the counselor's office, or walking them to an appointment, or calling the appointment and setting it up for them. It's going to look a little different now. So just making sure you know how to set up the Google chat, and making sure that you're familiar with making it as seamless as possible. So again, back to that store example, it'd be much easier if a clerk, once you build up that courage to ask the clerk about a product, and they say, oh, yep, I'll look it up right away, and they're confident in their answer and things like that, and makes you feel a little bit more taken care of. And on this level of mental health crisis, they're looking for someone just like that.
Great feedback, thanks. Now we're going to move over to the third column where we hear and see some information, have some interaction, and we're pretty sure that this is a dangerous situation and that we might be in the middle of an emergency and that we need some help now. So one of the first things to be thinking about is, are we going to call 911 or the police or not? And in this distance model, since we aren't with kids and we aren't able to provide that supervision, that immediate supervision, and walk them down to some professional help, then I think we're likely to end up contacting parents, contacting mobile crisis unit, contacting police more often than what we have done in the past. Because we just can't provide that same level of care and supervision that we have in previously. Along those lines, we tell folks to stay with the person and ask if others are involved. So I think staying with the person is going to mean something really different during this distance model, and it might be trying to have them stay on the phone with us or stay connected with them in some way while we're arranging for that in-person supervision. Allie, what would you want to add to this piece of information?
Yeah, thanks. You covered a lot of it there, but just making sure that we understand that we're creating a web of support around this individual at this time. There's a really good importance of prevention right now, so making sure you have these contacts in place. Now, that's not always going to be the case, of course, but making sure you can identify a few people you'd connect with for your students. And like I said, doing that ahead of time can save you a lot of stress at that moment. But exactly like you said, staying with the person is going to look a little bit different. But again, physical distance doesn't mean necessarily social distance at this time. And one thing that you can always look into is connecting with maybe their friends or a different type of individual in their life at this point.
Sure. Yeah, that's a good idea too, is how can we engage folks that are already in their lives and they're already with. So we recognize the need. We make decide that this is an emergency. We provide try and gain some supervision. And at this point, we're still offering those statements of empathy, creating a sense of hope, and sorting through how we're going to work with parents and do some documentation once we establish safeties in place. Right? What would you want to add here, Allie?
I would just say that this is a good part. It kind of walks you through it on this slide really well. But I want to make sure we'll go to the next slide eventually about taking care of yourself too. But with the documentation and then being able to really debrief after something like this is really important. But I think this slide's simple.
All right. And as far as suicide goes, our mental health flowchart is really kind of modeled after QPR, or question, persuade, refer, our suicide prevention strategy for all staff. So it was kind of fun that you mentioned that. What would you want to add about anything specific to suicide?
Yeah, specific to suicide and decreasing the risk of suicide, just that direct question about suicide can really make all the difference. And I was talking to Megan Levitt, who recently has always done this suicide prevention work. And me and her got to talking a lot about this. And especially at this time, if you feel like you need to ask a question directly about suicide, then I encourage you to do so. You can do no harm by asking the question. Remember, it will not plant a seed in someone's head. That's only a myth. Research is telling us the opposite. So I just want to encourage you guys for those who are trained in QPR, to really stick to that training as well. And then walking down a little bit, making sure we're trying to get into that communication line that's comfortable for the student. And then the third on the right there, it says try to gain agreement to be safe and get help. Remember, that's one of our, not last resorts, but we have a lot of tools in our toolbox we can use prior to that, but keeping that in mind. And then, of course, safety over confidentiality.
Yeah, one of the things I try and tell folks when they ask about confidentiality and trust, I want the student to trust me. And that's true. We want kids to trust us. One of the things I've told kids in the past is what you can trust is that I'm going to do whatever I can to make sure you're safe. Trust that.
Yeah, that's a great way to put it.
So when you do make that warm handoff, I know, Allie, you had wanted to share some things kind of right away about what happens when a staff member connects the kid to some help.
Yeah, so the reason why I really want to highlight the importance of this slide is because there's some sort of myth or rumors or things that you hear from maybe students and staff and say, oh, they don't always take it seriously. We don't always move forward with it. I don't even know what happens once I refer that student. And I think it's important when a student builds up the courage to talk to an adult or a trusted adult about these things, it's really important that you have an understanding of what that map is going to look like for them. So if they have any questions and you are already the trusted adult in that, you're able to really help them navigate through it. And that's why I think this slide is really important, that you guys understand there is an after plan once we go through that initial flow chart.
Yeah, sweet. Thanks for sharing that. We do have a district protocol. Admin, counselors, psychologists, MHPs, nurses, our SEL interventions, and social workers are all trained in it. We use the Columbia screening tool. We've got 3 levels of response depending on how kids respond or answer the questions during the screening tool. And we're adapting this to distance learning as well. And then for those that want to check it out, there's a link in the bottom left corner to the 2-page document that's pictured here. Allie, thanks again for being here. What would you want to say just to staff about taking care of ourselves too as we wrap this up?
Yeah, I think this is a really great slide that talks a lot about different things that you can do for yourself. But the biggest message is that whole key message of putting your mask on first. On an airplane, they tell you that, and it's for good reason. It's also a great analogy for staff and teachers and people that work with youth, coaches, anything like that. You can't pour from an empty glass. So you need to make sure that you're putting your mask on first so you can better help your students.
Yeah, that's an interesting analogy to think about in today's day and time too, with our COVID response and the outbreak and folks wearing masks, to protect ourselves and to protect the people around us.
Definitely.
And we got to take care of ourselves so we can help take care of others. On the slide, typically there's a bunch of stuff regarding, taking care of the 5 kind of main areas of a person: cognitively, emotionally, socially, spiritually, and physically. So I think some of those things just continue to apply. It's just we just need to be a little more intentional about scheduling them in, because it isn't happening as naturally with our regular routines. I'm going to stop sharing my screen here and just have a moment to say thanks for being here. I really appreciate you joining us and helping us out.
Yeah, thanks for having me. And just remember that I'm always a resource for you guys if you have any questions or need any resources for Crisis Text Line as well.
All right. Thanks so much. Bye-bye.
Thank you.